We have Dr. Willie Krom. He's a Sun City Anthem resident, was born in South Africa. He's an orthopedic surgeon who received extensive education first in South Africa, then in Britain and in the United States. After a long medical career, Dr. Krom retired as Associate Professor of Clinical Orthopedic Surgery at UCLA Medical School. In addition to his medical training, Dr. Krom has taught himself to play the harmonica and is now an accomplished musician. And we've had him here talking to us and doing the harmonica. And I don't know, you gonna do any harmonica today? No.
No
I'll
time.
tell you, it's probably what everybody was waiting for, right? Anyway, he's gonna talk to us about alternative medicine. Let's welcome Dr. Krom.
Thank you. You switch that.
No, turn that off.
Well, can everyone hear me? I'm mic'd. You hear me at the back? Okay, great. Well, thank you so much for coming to this talk. As you know, I've been, as John mentioned, I've been at this business, if you like, for a long time. And when folks ask me what made you go into medicine, I said, well, I couldn't get into law school. So a little about my background, and I do this to make a point. If you go back to where I was in kindergarten during World War II, and all the way through to when I started being able to go into practice, make a living, and support a wife and kids. It was my 29th year, almost 3 decades, and it took me to 3 continents. And after I graduated med school, which was 60 years ago this year, I had to do 6 stepwise exams along the way, including board certification, etc., but 6 important exams before I could go into practice, make a living, and become a member of the faculty. I've never not been associated with a medical school from day one, from a medical student all the way until I retired. And I had the honor and pleasure of being involved with several medical schools here and abroad. I could tell you from experience that the more varied you have as a career with the amount of input you get from different places, the better I think you'll end up being. So I'm telling you this because I'm in a way going to become an iconoclast in this thing. I'm going to destroy some people's idols. And I hope you've left your guns at the door. And I hope we still have, friends. I know a lot of friends here, but some folks that I see who I recognize in a week's time who don't return my greeting, I know which side of the aisle you're voting on. So, I don't want to come off as being arrogant, condescending, dismissive, or as an elitist intellectual. I have no intention of being labeled as such. The animosity that I do express, and I do have that, is to combat ideas and actions perpetrated by some individuals or even corporations. I'm not in any way directing my criticism as an indictment or impugning someone's intellect. I'm not saying you're stupid if you happen to believe something. We all are stupid in some way or another. We don't know everything about everything. And I'm just concerned about people's health or their, in a way, their pocketbooks, and if they're wasting their money and having false hopes. This is, it goes against the grain. So, if one is confronted with irrefutable evidence of something being absolutely wrong and silly and stupid and not worthy of belief. And having been shown this proof in black and white, and if you still believe in that thing, well, shame on you. You know, so bearing that in mind. A few weeks ago, John, we have a group, a smaller group of this club that meets on Friday. He mentioned that. And we discussed various topics. And one of the topics that I brought up for discussion was, and I'll tell it to you, is there in the 21st century still room for so-called alternative medicine? And I'll discuss what we mean by it, and you can make up your own mind. So John was there, and he said it needs a more expansive discussion, and would you like to talk on this? And I said, yes, with pleasure, thank you. So I owe this to John. So could we have the first slide? Ah, there it is. So if you look at this slide, this is just something that shows the life of a human being. You start off as an embryo, you go up to age about 20, and then you have a slow entropy. The word entropy is almost synonymous with decline. It involves the second law of thermodynamics, which is in a closed system, but we're not living in a closed system. We're open to the air. So the average life expectancy of someone in, let's say, the 50s was about 59 years. We now have statistics showing that for males, if you have reached the age of 65 and you don't have any major ill health, diabetes, heart disease, etc., you have an 80% chance of expecting to live to 84. And in ladies, it's 86. So when John asked me to give this talk, I said, well, hurry up, because I'm going to be 84 in March. So, and another thing, you know, we talk about adults. There's a steady climb until you're mature and ready to make babies and so on. The human brain, the forebrain of the human, the frontal lobes, doesn't reach maturity until the age of 25. So bear that in mind. So there are lots of things during our lifespan. Let's say, you know, we're heading for the 84. There are lots of things that we have on the way. And they may occur in childhood. You know, we have a fracture, but that heals, boy, and we're back to normal, running on our skateboards. And then we reach maturity, and then you may have another fracture somewhere along the way, but you get over that. I'm just taking fractures because that's what I used to do for a living. And then you get arthritis, and some nice doctor comes and puts an artificial hip in you, and there you go. And I meet you on the track over here, and we say hi, and all is well, and then you depart when you're 84. But sometimes it doesn't work out as well as this, and there are some folks genetically predisposed, or because of too many Big Macs, too much fried chicken, and the good old, you know, American lifestyle, too much barbecue, etc. Something happens, let's say, at the peak of their life when things should be getting better. But you've got the good doctors now who have things to get your cholesterol in check, give you insulin if you're a diabetic, and you get treated. And that will extend your life, but you may not get to the 84. And what happens, let's say you have a lymphoma when you're young, a Hodgkin's lymphoma, and you get radiation for this, which is good, and you have a remission. But the consequences of the radiation, or let's say you were a smoker for 20 years in your youth and your teens, they may cause problems with your genes, and that will come back to haunt you. So the consequences of the radiation or the smoking may catch up with you, and you might not reach the age of 84. So 80% of cases, let's take low back pain, which is another subject I used to spend my time doing. If you have an acute back pain, the chances of you getting better, that is, your pain becoming mitigated or less, is about 70%. Now, or 80% in many cases, within 3 weeks. And you can use hydrotherapy, you can use pain pills, and you can use bed rest. And the best thing to do is get in the pool and walk, and then slowly get on the track and walk, and that helps. If you should meet a chiropractor at the apex of when you're starting to get to get better, and the chiropractor does his manipulations on you, and you feel better, that chiropractor has you for life. You're going to praise him and tell your friends and say what a wonderful guy he is. But, take into account this regression fallacy that sometimes will happen. You're starting to get better anyway. And the chiropractors know this. So we can turn off the slides, and we'll come back to that last slide right at the end. So medicine is an art, and it's a science, and the accent being on the science, but the art includes compassion. You cannot go into medicine not feeling for your fellow human beings. That's a given. And it also includes the continuing pursuit of knowledge. If you believe yourself to be a scientist, and this is in science in general, and you think you have discovered or invented something such as a new disease or a new treatment for an old disease, or you've invented a prosthesis, another one for the hip, or a heart valve, and an operation requiring less invasive surgery with a little incision, take your gallbladder out, or a new drug that will kill the cancer cells in your body, or even a new method of preventing the development of a disease, you're required to prove it. You can't just put up the thing and claim that you have found it. You have to show how you did. If you don't, you'll be laughed out of town by other scientists. So here is a set of rules laid out for anybody seeking recognition for their efforts. And I'll just run through this. And if there's anyone here who is in any profession, whether it's engineering and you've written a paper, you have to have your proposal. What is your contribution? You have to have a proposal. What are you going to show? What do you have to show? You have, secondly, then, to speak about your method. How did you acquire this idea that you were going to show something happen? So it can either be after the fact, like you've done, 2,000 hip replacements, and you're going to now review how you did and how good a guy you are compared to, let's say, the other guy who's used another prosthesis. So you have to have lots of patience, like the more the merrier, which gives your p-value or your percentage value much more credibility. Or you can do it before the fact. You say that I'm going to give this medicine to someone or some group of people, and I don't know how this medicine works. I've tried it out on rats, and it seems to work. But I'm now going to try it out on humans. And there's a thing called a double-blind study. You give everybody pills, and some of the people, you tell them, may be getting a dummy pill, and some people may be getting the real medication. And this is, it's very selfish, but because someone who may really need the medicine with having cancer doesn't know they're getting the dummy pill. So this is medicine. You cannot make the rules. You have to go by what science dictates. So the third thing is the period of time. If you put a hip prosthesis in, let's say, and you check them in 3 months, gee, my results are great. How about in 25 years? Is it still there and is it working? So the time span for your thing. So, and then your findings on the statistical basis, whether you have an 83% cure rate versus a 17% not cure rate versus a 49% and 51% thing. It doesn't statistically show any benefit that you derive from it. So then you should, if you really want to, you've done all this work, you need to review the literature on the same subject and see what your colleagues have found for the same thing, and then you write your conclusions. Yes, I found this, or I didn't find this. And finally, you submit your findings for peer review. You send it to a journal, an accredited medical journal on that subject or that disease or that specialty, and or you submit it for a meeting of a medical society or medical association in this country or abroad, and you speak to your colleagues about it. And what it doesn't include, though, is putting a full-page ad in the RJ accompanied by a spaghetti and meatball lunch to cure Alzheimer's disease by a chiropractor and a naturopathic doctor and a GP who I looked up, and he had a review of his practice, and the man said that his office was a hole in the wall, and he looked like he had just gotten out of bed. So I have a bunch. In fact, this morning's paper was replete with such ads, and this is the modern age. You can look up their stuff. You can look up their degrees and where they are. They're all doctors. And you can look up the ingredients of the thing. It's in the smallest print way down near the bottom of their ads, and they will expose themselves. So I have tons of these. Anyway, so these are sobering statistics about alternative medicine. So the American public spends, and don't gasp, $27 billion on questionable medical care, exceeding the amount spent on biomedical research by allopathic physicians and other accredited legitimate scientists. And I'll mention this again, much of this money that physicians spend is to refute facts that are, quotes, facts put out by alternative medicine and proving them to be false or true sometimes. And this includes the ongoing discussion whether 1 glass of wine is good, 2 glasses not good, chocolate is good, and should it be dark chocolate, or, and coffee is good. Coffee has a varied career. Good 1 week, not good the next week. So, not only the 30%, it showed that the amount of money spent on this by the public, but that this is sobering as well, 36% of Americans use alternative medicine per year, and 50% of Americans will use alternative medicine during their lifetime. So those are sobering facts. Let me be quite clear, this is not alternative medicine. Any form of massage that is part of a prescribed rehabilitation program by a licensed physical or occupational therapist or a sports medicine jock that will massage a football player's leg if he is injured. These guys are professionals. They know their stuff. Getting a massage by your father-in-law is not alternative medicine. It just feels fine. Another form of, I'll talk about chiropractors, but their role in treating injuries is a bit controversial. I'll tell you a little about that. I don't advocate chiropractors treating children or adolescents with scoliosis. They do absolutely no good or no benefit from this. If you wish to discuss the pros and cons of the profession, perhaps we can discuss this at the Q&A part at the end, but I'll leave that open. Chiropractors have had a bad track as far as your neck is concerned. If you're elderly, I caution you not to have them violently manipulate your neck, because there have been incidences of them tearing your vertebral artery. You have 4 important arteries that go to supply your brain, 2 vertebral arteries that run in canals or holes in your cervical vertebrae, and 2 carotid arteries, of course. And if one of those is blocked, you may suffer a stroke. And there have been incidences of tears of the vertebral arteries as the chiropractors manipulate, especially in older folks. Weight Watchers is not alternative medicine. This is just a common sense form of medicine. So, but then you have the so-called mega vitamin gurus, and you've seen them. Just go here to Walgreens, whole side of the pharmacy with drugs. And very recently, I think in the last month, you've got the folks who tell you to have mega vitamins of vitamin D. And if you take, I'm already taking a lot, no, take some more. They have shown that exponentially, if you take vitamin D more than, let's say, 8,000 or 800 milligrams or micrograms, and the more you take, the more leaching out of your skeleton you're going to have. So the vitamin D starts causing osteoporosis or osteopenia, so it's counterproductive. So that certainly is something you should be aware of. Now, there's a term called quackademic medicine. Quackademic medicine is a term coined for time and money spent by academic medicine proving or refuting the false and fallacious claims advanced by so-called alternative medicine. Now, I don't know if you know James Randi. Have you heard of him? He was a famous magician, but he was also a refuter. If that's the term, he would become the exposer of people who really were taking advantage of the public. Not only people selling snake oil, but also the televangelists. He would go to their meetings and expose the Benny Hinns and the things in their ears and so on. So you can go and see him on YouTube. And he'd start off his hour lecture, open a bottle of pills, make a hole in it, it's a fresh bottle, take off the wrapping, and chug the whole bottle. And then he'd give his talk, and then at the end of the talks, he'd say to you, you know what I just swallowed an hour ago? A whole bottle of melatonin, and I'm not asleep. So he's done this in other fields, and he's a really interesting guy. So I remember as a kid and then as a new dad, coming from South Africa, there was stuff called gripe water. You'd give a newborn baby after feeding, and they'd have some gas, and you'd have to burp them, and you give them some gripe water, and you put this on their tongue, and I tasted it. Ooh, it tastes good. It's sugary and syrupy. And then one day I looked at the ingredients, because we got it from South Africa. Someone brought it to us. It's got tincture of opium and tincture of chloroform. Now, tincture is alcohol, but I said, my God, I'm creating a druggie in my kid. Anyway, they still have it, but it's changed. And what it contains now is good old Gas X that we all take if we overindulge. It's changed. So there's a term, if you're, do you know what syncretism is? Syncretism. It's a, let's take Halloween, for example. Halloween was a Christian rite, and still is, All Hallows Eve, that was hijacked in a way by pagans, and the pagans latched onto it, and now has become a holiday in a way where kids and adults act silly and knock on doors and so on. So it's sort of fun. But originally, so syncretism is latching on of one belief onto another and creating a whole. So in the same way that you have legitimate medicine, you have alternative medicine like chiropractors starting to treat diabetes with diets and so on. Something they should not be doing. They should stick to what they do best, and that is fixing sore backs. Now, the term itself comes from the word, that's a Dutch word called kwakzilver. Kwakzilver is a Dutch term for a peddler or someone selling snake oil. So about 100 years ago, the government latched onto this, and we've all, if you go, people send old-time ads to you, and you see all these ads for, back braces and special cures for lack of libido and up and down the scale, plus all kinds of medications. And they're fun to read, and their ingredients are wonderful. Remember, Coca-Cola started off with cocaine. So there are tons of these. So about 100 years ago, there was a Pure Food and Drug Act that was passed by the United States to try and combat the sale of useless and often harmful products for sale to the public. They were often given to children too, like the cocaine, and put them to sleep, and they felt good. And I mentioned the gripe water. And yet to this day, inadequate enforcement, they don't enforce these very well. And hence the newspaper, in the Nevada section, you pull it out, and it's got these lovely ads. So that President Clinton issued an executive order, and I'll spell it out, 13147, of a White House commission on complementary and alternative medicine. So the government's been aware of this, but they don't do anything. So there's an old nostrum when you become a doctor, take the Hippocratic oath, non nocere, I will do no harm. And that should be what alternative medicine should aspire to as well. If they're going to, please don't harm the public. So quackery is plain and simple a health fraud. It may be intentional, firstly, such as there was a something that occurred when I was in practice. Someone bought a thermography machine. The map of the world, they'll show you where the hot spots are. And the weather shows you, Nevada's always baking, and up in Canada, they're freezing. Folks invented a machine, a thermography machine, that would find where you're hot on your body. And so it didn't take long for physicians to say, that represents pain. That's why you're hurting there, because it lights up. Well, pain, you remember the scale on 1 to 10, tell us how much, because you cannot measure pain. You cannot, it's very subjective. So I was giving evidence one time on a workers' comp case, and I was on the stand, and they asked me, did I agree that the doctor who was giving the treatment, that thermography was synonymous with pain. So I said, no, there's a dichotomy here, because that same doctor, after saying, you know, his thermography machine found the pain, was hot packing the pain away with these hot packs and electrical pads. I said, he's got to make up his mind, you know. Is the hot pack taking away the pain, or was the heat the cause of the pain? So there's somewhat, and the jury smiled. Next, I'd like to discuss the placebo effect. Now, this is important. If you take something and you believe that it's going to help you, that is the placebo effect. It has to do with chemical transmitters in your brain, and you buy a ticket for the lottery, and you feel great. You're anticipating winning at $1.5 billion. And when you get it, it's yay, but you know, the anticipation was greater with the dopamine in your blood. You feel good. So the placebo effect is important. There are what physicians describe as getting medications in homeopathic doses, which means now homeopaths have this rather strange idea. If a medication, root bark or whatever, has been shown, someone went to the Amazon and climbed a tree and you know, got this wonderful stuff and brought it back, and now is marketing it, but in small doses. So if a lot of the medication is good, then a small dose is even more beneficial. So think of antibiotics. If you have an infection, you go to your doctor, he sends you to an infectious diseases physician, who then says, yes, you have this, and you need this antibiotic. And instead of giving you that antibiotic that will help you, I'm going to give it to you in 1/10 of the dose. You'd kick this guy out of town. You know, I mean, the whole thing sounds stupid. Quackery is plain and simple health fraud. Now, if this is intentional, you know, he knows this stuff, you know, it's root bark and the big spiel and the stuff in the paper and so on. And he knows he wouldn't put his kids on this stuff. If it's intentional, but it causes no harm, then, but if it does cause harm, you can sue them. But if they give you the stuff and they know it's not going to cause any good or harm, they can sue you for trying to take away their ability to earn an honest living. So be careful when you label folks, you know, quacks. It can come back to haunt you. So here's a partial list of things, and you know, some of them are obvious. We'll start off with cleanses. You go, no hands. We've all had colonoscopies, because if you haven't, you should have one, because it's preventative medicine. But, you know, the preparation is certainly worse than the procedure itself. And, you know, they give you a 5-year thing. You don't have to come back. Oh, thank God, for 5 years. So it's essentially a laxative, or a saline laxative that will clean you out. And you may lose about 3 pounds. Remember John Wayne had an autopsy, and purportedly his colon weighed 45 pounds with all the toxins and waste in it. I don't believe it. Anyway, the quick loss diets, they give you a diuretic, you pee out 3 pounds immediately. Wow, is this guy good, or is he good? So, and then there are the food fanatics, the vitamins, the anti-GMOs. Your labradoodle, by the way, is a GMO, your dog who's being bred. Antioxidants to prevent you rusting. Prevagen, we'll talk about that again. Coffee enemas, they're good. Beecham's pills. You all know what Beecham's pills, have you heard of? Sir Thomas Beecham used to be a conductor. He was a scion of the Beecham family, and that allowed him to go to music school and become a good conductor. But Beecham's pills, it goes back 150 years, contains ginger, aloes, and soap. And people would take it for a long time. Then there were Carter's Little Liverpools. Yeah, they were essentially bile salts, which again is something to make your tummy work. And there was a joke about this guy who died at 90, and he took Carter's Little Liverpools for 80 years, and they literally had to beat his liver to death with a stick. That's a joke. Anyway, and these are all things to help you be regular. Then there's sexual enhancement products. I won't go into that, but and these are beloved of men going through their second marriage. And then the anti-aging megavitamin pundits. I've mentioned that about vitamin D. Beware of that. And vitamin A, if you overdose with that, will make you ill as well. So it's naive to think that you can turn back your biologic clock. Remember, the entropy, if you are genetically predisposed to an early demise, or you're going to be 100 years old, is really determined by how many Big Macs you've eaten or not eaten, and your mom and dad's genes. Cancer cures. Now, this is highly controversial, and it's awful. It's important. Diet is important. And while you're undergoing treatment for a dire illness, it's important to keep up your nutrition. No one's going to argue with that. But to advocate a substitute for chemotherapy and or radiation by a diet with someone who is going to charge you $50,000, and you have to go to Mexico to have that special diet, I would say that's absolute fraud. Then there are things like aromatherapy, reflexology, hydrotherapy. It's nice to be in a hot bath, and I like standing in the shower. Who doesn't like standing in a shower if you have a back pain? And then you have this conscience about depriving the poor folks in California of their water supply, so you don't stay in there for long. Naturopathy or naturopathy. Their adage is, let the body heal itself. Well, duh, it does, and without your help. You've seen a tree flop over and it still has a few roots, and if the roots are sucking up fluid and nutrients, the tree will start sprouting branches, even though it's lying prone rather than up. So everything heals itself, or has the ability. And then the faith-based treatments. Now, the list is long, and some of you may even be involved with this, but televangelists, Scientologists with their e-meters, Jehovah's Witnesses, their kid may be bleeding to death, but they beg you not to transfuse them. Christian Science, we worry about their kids who may be developing encephalitis, and they don't allow the kid to be taken to see a doctor. Or adults who are having a heart attack or a stroke. They think it'll get better if they pray. Or they may be having pulmonary emboli or fractures. So the fracture will heal, but they may have missed, let's say, a scaphoid fracture, and they can't use their hand. I sometimes enjoy watching these folks on television, and my favorite is Benny Hinn. I don't know if you So anyway, there are the non-vaccinators or anti-vax folks, and I won't speak about them, but some of them believe that the flu vaccine will give you flu. Well, it does in a way, but it's very benign. And there's a lovely cartoon about a guy full of tattoos, was cringing his eyes up while he's getting his flu vaccine, because I don't like needles. So that was always good. And then there are a list of feel-good ministrations, or something that will give you temporary benefits, and these are good things. And this is not alternative. This is stuff that is welcomed and is good. So, you know, pain relief, better breathing things, relaxation and warmth. It should be, these things are incorporated into a comprehensive allopathic medical treatment regimen, including yoga, meditation, massage, I mentioned that, including chiropractic massage, but beware of the neck manipulation. Prayer is important. Biofeedback, which helps to control involuntary responses in asthmatics or in Raynaud's disease or in certain kinds of headache or some types of incontinence. And acupuncture is helpful. And also, let me say this, empathy is important while you are healing, and so, or getting better, or trying to get better. So the role of clergy is important. And family members, your kids, your brothers, your sisters, and also, even more importantly, your pets, your animal that you love, to give you solace and to give you a purpose in life. And these are important. And that's why we have these lovely dogs that come visit patients in hospital. I mentioned magnet therapy. People wear copper bracelets and swear that it helps their arthritis. Well, good. It may have a placebo effect, but it has never been shown to have an actual improvement in their cartilage loss. Electrical stimulation for fractures. I was an attending at Columbia Presbyterian Medical Center. One of the other attending developed this method of speeding up bone healing in fractures by using an electrical field check. And we still use that in recalcitrant fractures that don't get better. So that definitely does show. So in summary, a therapy claim that has not been subjected to a double-blind or randomized study really doesn't warrant any real validity. So beware of medical syncretism, you know, by naturopaths and so on who link onto something that sounds good. Let's put everyone on a diet to cure their diabetes and their Alzheimer's and so on. You know, if the neurologist cannot cure Alzheimer's, far be it for a naturopath to do it. So finally, why do people allow themselves to be taken in by these alleged alternative sources with little or no medical training? An analogy is to think that if you buy a car today, you want all the bells and whistles. You want to be safe in that car. If you fly in an airplane, you don't want to be in one of those Boeings that crashed, so you won't go. If you drive over a bridge in this country, you hope that the darn thing doesn't collapse. And so you depend on folks to give you the right clues and maintain your safety. So why would you gamble with your health by taking some of the stuff you can't even pronounce or know what's inside it? So we should talk about this whole thing about neurobiology, of what makes people do things. But let's have the last slide. Yeah, so we can talk about this. So the first reason is ignorance. And I don't mean people being stupid. They have little or no access to a physician. Someone in the boondocks who gets ill will find someone who has, it may even be a midwife who has some knowledge, and or they may be wise enough to say, I can't help you, but they may resort to going into the pharmacy and finding some homeopathic medicine. The second is anecdotal evidence and the placebo effect it brings. So, my cousin George went to so-and-so, and they took this medication, and it made them sleep nicely, and all was well. The second one is, I've mentioned this before, regression therapy. If it starts getting better by the time the chiropractor or anyone else gets to you, or your doctor gets to you, say, God, that guy really knows his stuff, and I'm going to send my cousin to him as well. Confirmation bias, that means inductive reasoning, playing on one's own personal bias. Now, this goes back to when you were in a womb, and during the second trimester, your mother listened to some fine music, or when you were born, you grew up in a religious family or a particular in a particular religion. You had the mores and customs of your tribe. You remembered what mom said or dad used to say, and so on and so forth. So you carry this with you into adulthood and then into your dotage. And then the fifth thing is distrust of conventional medicine. Okay. Drug companies make so much money. Well, the hell they do. They really do. And the other adage is all surgeons want to do is operate. Well, they've been trained to do operations, and the vast majority of my surgical colleagues would prefer not to operate if they feel that something is going to get better on its own, like the 70% of backs that get better, or they feel that you're too old or too feeble to undergo surgery, and they don't want to hasten your demise. So they won't do an elective operation. So, but when you have something that needs surgery, or you're told you need to have surgery, you feel, and you're going to get a second and third opinion, you feel like you're a nail, and the rest of the world is a big hammer. So I can understand, people feeling very distrustful. Then conspiracy theories. Well, the AMA, the FDA, the CDC, the CIA, the FBI, and Congress are all in cahoots with Big Pharma. Well, sometimes, when you go to pay for a medication and it's $500, you say, well, why are you paying that? And the drug has been out for 10 years, Surely you've made up your expenses by then, and something should be done. The fear of side effects. Did you know that chemo is a poison? Well, duh. That's what it's designed to do, to kill cancer cells. And it doesn't kill you, but it will make your hair fall out. We can tide you over that until your hair regrows. And I take a medication for neuropathy that is called Lyrica. And it increases your desire for food, makes you hungry. In some people, not everyone. And people say, I'd rather have the neuropathy than put on weight because I can't get into my nice clothes. Some of the chemotherapy have bad effects. They can damage your heart valves and so on. But in today's science, we have ways of correcting the heart valve damage and so on. And then this is really sad, the cost. Some folks will forego their medications because they need the money for food. And this is a tragedy. It should not happen in this country. There's desperation. Remember Steve McQueen with Laetrile, almonds, going to Mexico. If you're really at the end of your tether, you're looking for a magic bullet, and you'll go anyway and pay anything for it. And then pride. Did you notice how Prevagen ads have quadrupled since they were outed by Consumer Reports? They were told, were analyzed, and it's complete junk. Now they've modified their ads and say it's for short-term memory loss. And then what do you do when the memory loss comes back? So, but they are selling this stuff like hotcakes. And if you go into the pharmacy, it's $54 for this stuff. And there are copies of it, Nutriva, Nitriva, or something. So their pride is affected. And then outright fraud, authentic-looking ads for cures for neuropathies, and I have a collection here that is interesting reading. So that's my talk, and how did we do? We've got time for questions. Yeah, Dwight.
Willie, under the concept that you are what you eat, can you comment what your opinion is on organic food versus non-organic food? Usually it sells for 15 to 30% more than regular food. Is it worth it? Is there any significant difference in your opinion?
Well, the terms natural, organic, and so on, or non-GMO. Food is food, and if you take a vitamin C, whether it's from rosebuds or whatever, or vitamin C is vitamin C, it's a chemical. And the same with food, it's essentially the additives to food. If you look at the labels, and there are things that you cannot pronounce, all the additives that they may be preservatives, so the stuff doesn't stink by the time you open the package. Those are a necessity. But organic means that they haven't used stuff to spray on the food, and the bugs are kept away by some other natural means, and you don't have the chemicals or the hormones that the other non-organic foods have. So if you want to avoid hormones and you want to avoid chemicals that you kill bugs, I would tell you, really look for the organic label.
Hello. Hi, Dr. Krom. Real nice to have you here. I really appreciate this discussion. It's really great that you're doing this. I just was trying to narrow down something related to what is called lymphedema. Lymphedema, as in some kind of like poor circulation in the lower limbs and your ankles. Lymphedema, as in swelling of the ankles and lower limbs. And aside from what's being told about, of course, your diet, you limit your salt intake. I never eat salt. I don't salt things and things like that. But basically, is water retention an actual?
Okay. I think
I was just saying water retention as a whole. Is that related somehow to what they call venous insufficiency syndrome? Basically, are you familiar with venous insufficiency syndrome? Venous.
Yes.
Excuse me. And how to combat it.
I get your. There are a lot of causes of lymphedema. They may be local, that is in your leg, or they may be general, like with cardiac failure, you get swelling of the legs, and eventually it will turn into a swelling that doesn't go down, and that's because the lymphatics are overpowered. Or you, in the jungle in Africa, you get filariasis, and they block the little. But the vast majority of lymphedema in this country is due to peripheral vascular problems or vein blockage. And there are superficial veins and deep veins and the veins that link up the two. And if you get those blocked, you get first swelling, and then that will turn into lymphedema because there's not enough stuff to be able to take it away. So, so the vast majority of problems, we don't have filariasis in this country.
So in follow-up, just what are your most highly recommended, natural remedies for that?
Well, there's
materials.
massage. They have massage things, and you can take diuretics if you have it due to heart failure and so on. So I think it's a subject that is real medicine, and rather than discussing alternative medicine, that's a real condition.
In fact, there are many fallacies surrounding that. and I don't probably need to mention right now, especially, no, I mean, I'm sure that many people know what those fallacies are.
Right.
And how they relate and don't relate to the
Right.
condition.
Perhaps, okay. Yeah.
Is glucosamine and chondroitin a real supplement? Does it
Chondroitin,
help?
yeah, that has been shown in studies, multiple studies, to be beneficial, just like stem cells, regenerating cartilage or making other organs, such as heart valves or esophagi. Stem cells are good, and so is glucosamine. It's been shown to be beneficial, or injections of glucosamine into the knee are beneficial.
I have knee surgery scheduled for next month, but I've been hearing a lot about what you were just mentioning, stem cell treatment for arthritic knees. But I've also been told that that's years away, and it's a lot more research is going to be needed
Right.
before it's actually a
Right. Yeah, that's stem cells are not alternative medicine. This is they have studies and they can reproduce results. I would say that if you have bad osteoarthritis in your knee and you're under 50, such as an athlete who's damaged their knees, they are great candidates for stem cells. If you have a lot of time, you're going to not pass away in the next 30 years. It's good because it allows regeneration. But if you're 84 and you have bone on bone, you don't want to spend your time, nursing your knee. You want to have a total knee replacement and get on with your life.
So if you're between those ages, is it a treatment that is
absolutely.
currently suggested for
Absolutely.
arthritic
and
knees?
how good your health is in general. I mean, if you're a jock and you've got the time and you're younger and you're willing to put in the time and the money and everything else that goes with it, but you have to wait till those cells make cartilage. It's not like an instant thing.
Thank you.
Dr. Krom, I've been thinking about trying acupuncture,
Yes.
which you mentioned as sometimes being helpful.
Right.
So can you talk more about that and what I should look for in an acupuncturist?
Yeah. Well, since Nixon went to China, no one had heard of acupuncture before, but it has benefits, and are they predictable or not predictable? If you do studies of them and you put patients through, there's a placebo effect as well, but you can match group for group and show, because everyone's pain is different, and you can say that 58% were improved and 42% weren't. You can show that it has been. So why not try it? It can't do you any harm.
And is there a way to look for the best acupuncturist?
Try, Wongu. They're down the road on Easton. And they're good people to try it on.
Thank you.
Wongu. It's the Chinese Academy of Medicine. Wongu. Sure.
How do you spell that?
Wongu. It stands for something university. Oriental medicine. Sure.
I have a question about insomnia. I've
Yeah.
taken every herb, every essential oil, every tea for years.
Yeah.
Nothing works. My doctor finally gave me Ambien, and Ambien helps, but then the next day I'm feeling groggy and lightheaded.
Right.
What is your opinion of Ambien? And if you don't...
Well, you can sleepwalk, and that can be dangerous. And the withdrawal symptoms you can have on stopping Ambien suddenly can be devastating. And you become a junkie. I would probably try temazepam as an alternative.
what is that, lorazepam?
Temazepam. It's a Valium-type drug, and
Is that trazodone? Because somebody told
No.
me trazodone.
temazepam.
Temazepam
Temazepam.
is better.
Yeah,
Okay,
probably better.
temazepam.
Don't quote me. Right. Anyone else?
Just one follow-up on that. What about the non-prescription sleep aids like Advil PM or Tylenol PM? Because those are less addictive, as I understand it.
I mean, they have melatonin. I mentioned James Randi not falling asleep with a whole bottle. Yeah. You can check him out on YouTube. Yeah. Okay, well, thank you very much.
Thank you.